I would like to thank the organizers for having me again at this virtual, and I'm excited to present to do the next generation mitral devices for repair and replacement. These are my financial disclosures. And the structure of my presentations are shown on this slide. Some brief remarks about surgical and transcatheter mitral valve therapies, update on treatment options for TMV repair, new innovative solutions for TMV therapy, and update on mitral valve replacement devices. And then I would like to finish with some final remarks. We remember, with this claim, we started the TAVR journey many, many years ago. All things being equal, less invasive therapy will always reign supreme. Have we achieved this goal in mitral valve disease yet? The repair and replacement design goals are very clear. They have to be safe, efficacious, and easy to be used. If we compare the two, surgery and catheter, I have to say, though, that surgery is still the gold standard for mitral valve replacement and mitral valve repair. Transcatheter approaches have not achieved the level of safety and efficacy yet. We might have to find new, innovative solutions outside the surgical toolbox to achieve the same results as surgery. Here are some points on current surgical treatment options. Surgical treatment for mitral regurgitation utilizes a toolbox approach, mainly annuloplasty, leaflet resection, and chordal repair. Mitral valve replacement is performed only at a rate of 34%. Management of secondary MR with conventional surgery is obviously less common. So we know there's an unmet treatment need. In a US community cohort study of patients with moderate and severe mitral regurgitation, they found mitral valve surgery was performed in only 14% of patients with either primary or secondary MR. These results suggest the unmet need in these patient population might actually be higher than expected. These are the numerous transcatheter mitral valve repair devices that are under development. Many, and that actually might indicate that none of them really work very well. The repair devices target the leaflets, the annulus, and the chordae, as shown here on the left side, basically the clip, Pascal, Carillon, Cardioband, Millipede, Neocord, and Harpoon. These are the edge-to-edge devices presently in use, mitral clip and Pascal. The mitral clip has the largest experience of any transcatheter mitral valve repair or replacement device, with more than 100,000 cases worldwide. Pascal received CE mark in 2019 and will compete with the clip in the future. The global EXPAND study showed 97.5% of patients achieved MR less than 1% at 1 year. Mitral regurg less than 1 was achieved more often with the NTR and XTR compared to earlier device iterations. Significant MR reduction obviously was associated with improvements in quality of life. The CLASP study of the Pascal device showed that the procedure was safe with a composite MACE rate of 14.5%. 82% of patients had MR less than 1 at 1 year and also sustained improvements in quality of life. The next generation Pascal ACE device will be narrower with the ability to fine-tune to optimize mitral regurgitation reduction. Those are the devices: indirect annuloplasty, Carillon, MVRX Arto, and mitral loop cerclage, direct annuloplasty, Cardioband, Millipede, Valcare, Valfix, and AccuCinch. The Carillon device, the longest out, received CE mark in 2009, began commercialization in 2011. The device is a coronary cinching system. The results of the randomized sham-controlled reduced FMR trial showed excellent safety, reduced MR severity, and the device resulted in favorable remodeling of the left ventricle. Of note, though, 71.4% of patients were in class 1 or 2, and only 28.8% in class 3 or 4. This is an example before the Carillon and 1 month after the Carillon. You can see very nice coaptation of the two leaflets due to the cinching of the device and of the remodeling of the left ventricle. Cardioband is a percutaneous direct annuloplasty system that utilizes the transseptal axis. In the CE mark study, the safety profile was favorable. Reduced MR sustained out to 2 years, but there was poor technical success, 78.3% due to anchor disengagement. The Millipede device is a percutaneous direct annuloplasty system, 2019, acquired by Boston Scientific. A feasibility study was initiated in 2019 and is currently enrolling with a redesigned device. Moving on to the chordal repair devices. Here are the transapical devices, Harpoon and Neocord. And those are the transseptal chordal repair devices, Pipeline, Cardiomag, Corematic, and Neocord. All those are in their early stages. Pipeline has done 2 cases in humans. The Neocord has a relatively large experience with more than 1,100 patients treated. Studies have provided patient recommendations based on mitral valve morphologies. The prospective multi-center RECORD trial aims to enroll up to 585 patients, of which 60 will be non-randomized roll-in patients, 450 randomized to Neocord repair versus surgical repair, and 75 non-randomized high-risk patients. A complex study that will last some time. Harpoon, chordal repair implant system, utilizes a needle with the EPTFE suture used to fix the mitral valve leaflets to the apex. In 2 prospective multi-center studies, early feasibility and CE mark, the device's primary endpoint was met in 91% of patients. Mortality at 1 year was 3%, reoperation required in 13%, and mitral regurgitation less than 1 achieved in 75% of the patients. Combination therapies with annuloplasty are obviously possible. Here are some examples: Carillon plus clip, Cardioband plus clip, Millipede plus clip, and the Cardioband and Neocord. Moving on to an interesting session, which is innovative mitral repair solutions, which is neither replacement nor total repair. It's probably in between. Posterior leaflet enhancement and replacement is a rather new focus area for TMVR, and these devices are early in their experience. The Polaris system, the Sutra system, the Half Moon system, and the AV system. Very interesting devices. And here you can see fundamentally how it works. Here is the device implanted in the region of the posterior leaflet, and the anterior leaflet coapts quite well with the posterior device. Here you can see the implant, its delivery and anchoring system. You can see the implant on the left side, and you can see here the anchoring system, 5 screws with a central screw and 4 lateral screws. This is the first in human, November 22, 2019, by Dr. Schäfer in Hamburg. And you can see here the device and the screws anchoring the system. Polaris pre and post results are shown here, pre-implant and post-implant. Very nice reduction of mitral regurgitation to maybe trace. Next is the Half Moon repair device system. Recently cooperating with Medtronic, this device is designed to eliminate regurgitation by restoring physiologic coaptation in a diseased mitral valve. This brief animation shows you the principle. Here you can see in a second the device implanted into the left atrium, and here is the device, and the anterior leaflet coapts quite nicely with the posterior application, and this reduces mitral regurg. TCMV replacement devices in humans: Transapical, Transseptal, Intrepid from Medtronic, Tiara from Neovasc, Tendyne from Abbott, and Transseptal, Cardiovalve, Cephea, Highlife, Evoque, and M3 Sapien. This is the timeline of the devices. CE is certified for Tendyne, and you can see some of them are already resting in peace. Those are the 4 that are already gone. I suppose some more will follow. Those are the numbers in humans up till now, but these changes almost daily now. The reported human experience, the list is led by Tendyne and Intrepid, followed by Tiara with more than 71 patients, and Edwards and 3 with 43, and Evoque by 23. High Life has 15 patients, and CardioValve and Sophia more than 7. A brief device parade. The Tendyne device from Abbott, the largest TMVR experience, is this with this retrievable and repositionable device. Tendyne received CE mark in 2020. Mortality rates at 2 years were 39%, MR less than 1 in 100%, and improvement in New York Heart Association functional class 81.7% were in class 1 or 2. Very nice result. The Summit revised pivotal trial, on the left side, you can see randomization between Tendyne valve and the clip. And on the right side in red, non-surgical patients, the MAC cohort and the control device. The next generation valve and sheath are integrated and a complete retrieval will be possible. Moving on to Medtronic's Intrepid device, reported outcomes were generated with the Transapical device, but the transfemoral early feasibility study was recently FDA approved. The 51 patients from Apollo roll-in had a 2% 30-day mortality as shown on this slide. Here you can see the Apollo updated pivotal trial design, which initially randomized against surgery, but now changed to 2 arms. Here the TMV arm and here the MEC cohort arm. FDA approved, and this device is this study is presently enrolling with a 2nd generation device. Tiara from Neovasc, the self-expanding device, anchors using ventricular posterior anterior taps to fix the valve onto the fibrotrigon at the posterior annulus. The Tiara 1 and 2 trials showed a 12.7% mortality at 30 days, mild or less MR in 100% of patients at 1 year, as you can see here on the screen. The next generation Tiara devices are here on the transseptal approach system, less than 30 French, smaller ventricular footprint with less structural material, and the device is retrievable up to the last point of the device following the anchor release, improvement to the present devices. All of the 3, once successfully implanted, had achieved the design goals. 0% of patients has MR more than 2 at 1 year, and that is excellent at what these devices should actually achieve. Sapien N3 system is a dual stage system, a docking station that is delivered first and circuits the native leaflets and chordae, followed by delivery of the Sapien 3 TAVI valve. It is a transseptal access. Early feasibility and compassionate use outcomes in 45 patients were favorable. Mortality at 30 days, 2.2%, mild or less MR at 7% of the cohort. Basically the same approach you can see with High Life, a valve in ring approach as shown on this slide. And here you can see a case. The nice thing about this device, the footprint in the left ventricle is very, very low. Another interesting approach is Saturn adaptive technology. It is a single device characterized by an annular structure mechanically connected to a central valve, as shown here. This is a solution to address the challenges and the wide variability of the native annulus sizes. It does reduce the mitral annulus and fixes the valve and the annulus. Another interesting approach is the Elta Valve. You can see here on the slide, there's a nitinol stent with multiple sizes to fit the left atrium, as shown here. And then within this spaceship, you can see a bovine tissue valve, 27 millimeter. The first transapical approach has been done in Quebec by Dr. Rhodes-Cabot, 2018, and the 1-year follow-up still shows no MR. The first transseptal Elta valve case was done by Dr. General in Morristown, and you can see here also no significant MR at follow-up. Coming to the last slide, the take-home message. Edge-to-edge techniques are currently standard of care. Large numbers of patients are treated, well-studied device, randomized control to support the indication in DMR and FMR. Excellent safety and acceptable efficacy. Limitations are residual MR, future options are maybe excluded, and the results are not predictable. Not all anatomies are suitable. Other repair options that will be important for the toolbox include annuloplasty devices, transseptal chordal devices, and posterior leaflet enhancements. As far as replacement is concerned, the progress has been slower than expected, but continues to grow and innovate. Transapical valve programs are showing very promising feasibility, and the patient selection still remains a challenge. With that, I would like to thank you for your kind attention, and again, thank you for having me at this great meeting.